Hi, and welcome to Digital Health on Air. I am Kasha Sheikh. I've worn many hats here at Luma, leaving customer success where I work with many of our largest enterprise customers and moving over to an account executive. To join today, I am with Min Lowe, who is one of our product experts, and Scott Serrano, a longtime enterprise account executive. Today, I'm excited. We're talking about list feature. And one of the things that I love about Luma in general is when we marry the patient experience with the clinical or operational efficiency for a health system. And waitlist is one of those great spots because we think it does two huge objectives. One is it opens up access. And we all know access is crucial to so many systems, whether you are rural, urban, large IDN, a small practice. But access in just opening up options to patients means nothing if there's not capacity behind it. So it also touches the capacity side of things by creating opportunity for patients to get in, for slots to be available. And again, it's a two-sided coin because I think without that capacity, access would mean nothing. So I'm really excited to talk about waitlist and the efficiency gains that it can deliver to our customers and potential customers. One thing that really jumped out to me was that in a recent survey that we commissioned, we found a whopping 91% of the surveyed health systems had no automation for patient wait lists, which to me is a little bit mind-boggling these days. But it tells you a little bit about some of the movement in healthcare and how it's taken so long to move over to some of these things that we take for granted in other consumer-driven aspects of our life. If you think about me getting my car serviced or getting on standby on an airline flight. These things have existed in so many other parts of the consumer experience for so long that healthcare is sometimes slow to catch up. And even then, it's not completely configured correctly. So one thing I really dig into was kind of the archaic manner in which some health systems are currently doing this and without an automated solution. I talk to health systems, which are honestly some very large health systems, which still pick up the phone and call a wait list from names that are on a piece of paper, which look, changing the way that you did things before is difficult. Change management is difficult. But to me, that's just such a mind-boggling approach when, from both perspectives, both the patient experience of needing to catch the patient at the exact right time, to get them on the phone, to look at their calendar, to be able to see if that slot works for them. And also just the staff burden of picking up the phone and essentially cold calling patients over and over and over again, and then having to schedule them into the system while you're looking at it. So that pain to me is so real and so tangible. And I'm wondering, Scott, from your experience in working with these systems, first talk a little bit about how you hear about some of that pain when you're first having the conversations. And maybe after some of these customers have gone live on Luma Waitlist, what some of the ease of that burden looks like for them.
Yeah, I mean, a lot of the current state is, if you think about when patients cancel, again, it's last minute or they're trying to reach out after hours. And so the effectiveness of the health system manually calling down on all of those patients is incredibly minimal. So the conversion of waitlist today, one, manual, two, completely ineffective. And so the automation of outreach, from Luma, once they have put that in place, it's reaching more patients, right? And so the conversion of that on the patient end is speed to care, which is humongous. So there's a humongous operational lift to reposition employees to focus on more meaningful things throughout the day, which is a huge benefit. But I think from the patient's perspective, speed to care is everything. And so, we met in your example on the specialty side, I mean, for me personally, my daughter waiting to see a specialist is, 4 or 5 months, right? We have to wait to do some things. And just, I think even from a healthcare, telling patients that they are offering this, like, hey, we have an automated wait list, this is something in our toolbox, is a huge selling point for health systems to at least mention. and then of course to deploy. But it gives the feeling that they are doing everything they can to optimize every single slot that they have.
Yeah, and there was one pain point you highlighted there, and that is that, matching a patient up to the right visit. If you have a wait list, you may have them for Dr. Smith for some type of exam, but you have to make sure that when you're offering them a wait list slot, like that same provider, same visit type is available to be scheduled there. Weeman, could you talk a little bit about the automation, that specific pain point of matching one-to-one and how we make sure that we are alleviating that pain for health systems by putting the right patients into the right spots?
Yeah, for sure. So like, a patient is, booked for a particular appointment type with a particular provider for a reason. And we want to really respect that, because the downside is that if you were to have them be seen by someone else that is not what the patient is expecting, it could really impact their care. So, that's why it's really important that when it comes to any kind of automation waitlist, we really respect how the patient has already been scheduled. And we want to make sure that when it comes to rescheduling the patient, we remove the need for them to re-explain their healthcare to another provider, and that they're allowed to continue their care as they have expected, but maybe sooner, or if they have canceled again, with another time and date.
Yeah, and I think that all of these examples are anecdotal, but what is really fascinating to me is these light bulb moments when health systems actually implement waitlist and start to see it work its flywheel. And we have seen customers very directly have very, very tangible results. And I mean, we have some that have nearly 50% fill rates. And for some, it might be, as you mentioned, on the margins, specialties, some of them are not going to have a lot of slots. So even a 4 to 5% gain in that very niche specialty is going to have a huge bottom line effect. From an operational standpoint, one of my favorite things about waitlist is the ease in which it's implemented, that there's really not a whole lot we need. There's not a whole lot of configuration on the customer side. We need to know which appointment types, which providers, which facilities, etc., and we can do the rest for you. Can you talk a little bit about that ease of implementation and how quickly we can get speed to impact in solving some of these pain points?
Yeah, for sure. So like, as part of, Luma's workflow, we are already integrated into your EMR or PM system. So we know the appointments that the patient is being seen for. So, and if patient cancels, we also know that, so we can also proactively reach out to them. In terms of, implementation, it's straightforward in the sense that, there is just very clear settings that you need to modify so that you can, again, adjust the patient experience you want to give. Like, for example, do you want to, how do you want to share the offer to a patient that's eligible on the wait list? Do you want it to be in a sequence order, or is it more in parallel fashion? So those are some of the configuration that is just to tailor a bit more of the experience you want to give to the patient. But in terms of the outcome, the goal is always to get the patients rescheduled as long as they're on a wait list and whenever a slot is opening up.
Yeah, and what I hear as someone who has worked with customers extensively is that automated. We are doing all of this. Once you set it, you are basically forgetting about actually managing that wait list, and Luma is going to run this behind the scenes for you. And that ease of just putting it in and having Luma fill those slots automatically without you needing to go in and authorize and check and do all the steps that might be needed to have a waitlist slot filled is, to me, invaluable. And we all know that systems are so overburdened right now, and you have people wearing 10 hats trying to do all kinds of different functions. And so the more you can take off of staff to do that automatically while delivering both top and bottom line efficiencies by filling these slots, to me, it's incredibly valuable. And again, like going back to the 91% of those systems that we spoke with that did not have an automated wait list, I think about the network effect of those providers being able to fill their slots more efficiently. I think about the staff who then can spend their time on patient care and not have to deal with filling up slots or calling patients to see if they'd like to come in earlier. And all of the downstream effects that just basically lead to better patient care and more utilized slots. And Scott, I was hoping you could touch on a little bit just what are some of the reactions you get when people who maybe don't fully understand waitlist see it in action?
Yeah, I mean, for me, and in the discussions introducing waitlist, I think the ROI tied to it is the easiest to articulate and to demonstrate. And in my opinion, and introducing it into health systems, it's the easiest thing to introduce because it's such a no-brainer. There's so many gaps because obviously budgets are tight, time is tight. You're losing money with these unfilled slots, right? So on average, it's between $100 or $175 per appointment. And so if we could fill 5 a day, right, or more across a health system, that the ROI is very, very significant and tangible. And so, I know we had an SJ Health example as well. I mean, current customer of ours, they had they had several systems in place, multiple EHRs that they were managing. And they told us they tried to solve this efficiency problem. They had a whole stack of different solutions, patient communication, care gap outreach, reminders, but they were spending a tremendous amount of time on resources, staff, and it wasn't moving the needle. And so, and especially with our data analysis, we see appointments are getting canceled within 2 days of the appointment. So the outcome that they were able to see was immediate, right? And so the ROI calculation behind it is the hype is real.
Very well said. And again, like I think that all of this information just keeps coming back to the point that with the combination of access and capacity that is achieved by waitlist, the efficiency gains there are just off the charts. And I think it's something that we see every day, and it's really enjoyable when we get to see our customers really visualize the benefits that they're getting from it. So if you happen to have efficiency problems similar at your systems, please feel free to reach out to us. Thank you, Scott. Thank you, Hui Min. And it's a wonderful discussion. And we look forward to seeing you all again.
Thanks, guys.
Thank you for having me.